Chibanzi, Secretary General, KMPDU, they're with me here. But let's hear what you have to say, because this is a town hall session where your voice comes first. Here's some of your views, the ones who sent them in on video. Listen.
The virus is here to stay. It's here with us, and we must accept that fact and live with it. What needs to happen is that the government needs to be a little bit strict in enforcing the measures and the guidelines that they have given to us.
I would like to urge the government to reinstate its restrictions, because if we continue to behave in this manner, we will risk the lives of many Kenyans and hurt the economy even more.
We need to go back to that if it is guided by science, and of course if it is guided by the Ministry of Health, because even countries like China, Germany, France have resorted to reinstate the lockdown measures that were put in place. Safety is key.
Most of the people in Kenya live from hand to mouth. Now, taking us or taking the Kenya back to lockdown, meaning it will not be possible this time around.
President must not reintroduce new COVID-19 regulations, but instead, each and every person must be responsible for his own to make sure that they observe the said COVID-19 protocol.
Now, for me, it's more about personal responsibility than just reinstating those restrictions. I believe we have a personal responsibility to ensure that we are safe.
Will reinstituting back the restrictions be a good thing to the economy that is currently bleeding? And who is to blame between the political class, who are publicly defying the coronavirus containment measures, and the general public? Thank you.
Professor, your thoughts on this? Because, you know, our first strategy was test, isolate, and treat. Should we go back to that? Because we're not even seeing, is there even contact tracing happening as we speak?
Our strategy has actually not changed. We have a testing strategy which clearly defines who should be tested, and those are people who fulfill a case definition. Thereafter, you must then do contact tracing as to who was into contact with this individual who has actually tested positive. You then must isolate these individuals either in a health facility for those who require health facility admission, or home-based for those who require home-based. So that strategy is still in place, and that is actually what is still ongoing. What we just want to reiterate, or what I want to reiterate, is to ensure that there's no laxity in the counties, no laxity in any place to think that COVID has gone away. COVID has actually not gone away, and that strategy still remains.
Yeah. Dr. Chibanzi, let me bring you back on this. So where did we miss the mark according to you? Because we're looking at a situation where people no longer wear masks, and the infections are continuing to rise. How can we then change that message to ensure that everybody sees how serious COVID-19 really is?
So let me start by saying that initially what we saw was a very heavy security type of enforcement of the restrictions and guidelines. And that's only at that time, when we had the panic across board, only used a lot of fear to try and effect behavior change. So now that COVID is here, and it's going to be here for quite some time with us, then it means that we need to change our messaging, because what you're targeting is behavior change, for people to accept that, one, COVID is here with us, it is real, it is a disease with us. Because up to now, Trevor, I can tell you for a fact, out there, the public thinks that COVID is a hoax, and it was about making money. The government was just trying to make money out of the situation. So that notion needs a very different approach to look at, want to try and effect behavior change of the population. So I think what we did not do very well in the initial stage was the fact that we used a lot of force and security forces to try and enforce these guidelines. So basically, then now it means we need to go back down to the communities, ensure that the community leaders talk to the people, hold sessions where there's still awareness and sensitization of this disease, in as much as Kenyans are tired and more of them are now looking at their livelihoods as opposed to their healthcare.
Okay. Professor, you know, the first time we spoke, there was a debate whether we should brace for increased infections and hope for herd immunity. Isn't that where we're heading anyway?
Yes, yeah, we actually talked about issues to do with the herd immunity. You know, but herd immunity has two aspects to it. There's an aspect of immunology, and there's coupled to that, there's an aspect of epidemiology. The aspect of immunology is that once you get exposed and then you recover, then you develop immune response that protects you from subsequent infection. Now, then those particular individuals need to increase in number to the extent that from the calculations we are seeing now in terms of understanding the natural history, you may require that 50 to 60% of the population get infected and recover to be able to say that you have actually generated a herd immunity, in the sense that there are fewer susceptibles, than those. There are much fewer susceptibles. Now, the issue with the SARS-CoV-2 and COVID is that there are now emerging anecdotal reports of individuals who have recovered who are getting reinfected. That is a worrisome phenomenon. Number two, there is also an element of rapid decline in the immune response. That is also a worrying phenomenon. So achieving herd immunity is still would be the best case scenario, but at the same time it will come with costs, because you must then be able to work very hard and shield those vulnerable from mortality. So really for us, from the immunological aspects of it, from the research we are doing, trying to understand the natural history, really what we are bracing for is to have a vaccine. To have a vaccine that will be effective, even if it's 2 doses a year, that will be a game changer in terms of how we are going to manage COVID now and in the future.
Okay. Dr. Chibanzi, based on what you've seen so far, are there the long-term effects of COVID-19 after exposure? Because there are many other people who've been saying that even after you've recovered from COVID-19, there's still some long-term effects that you live with.
Yes. From the literature that was there and from those who suffered in Europe and other countries, and looking at the case reports and the case presentations that have been published, is that one, you have to look at it from a point of which system was adversely affected when you get COVID. For instance, the damage in the lungs is irreversible lung damage. Depending on the proportion of the lungs that are affected, then you could have those effects of breathlessness for quite a long time. And there are so many people who actually recovered but still have these symptoms of difficulties in breathing, or rather they have these episodes where they become breathless, and that is because the lungs were affected quite significantly. Of course, the other long-term complications around the other systems, there's still more evidence coming out, but essentially like the heart, the kidneys, and at some point there were certain cases that also got some level of damage to the brain, and we've seen cases of reports reading through the literature where there are those who have some level of psychosis that is from brain consequences of the infection. So yeah, there is that, but it also depends on, as I said earlier, on the individual's response to the virus and how much the disease affected your system and organs across the body.
Okay. Professor, is there a need for mass testing at this point, all factors held constant?
No, not at all. We should not go back to that. Mass testing is not a strategy at all. We developed a testing strategy with the Ministry of Health. We must adhere to that testing strategy. It clearly defines who should be tested in terms of those who fulfill case definition and what should happen thereafter in terms of contact tracing, in terms of isolation, either in a health facility or at home. And it is only if we adhere to that strategy that we shall actually have enough data coming in to tell us exactly how the measures we are putting in place give us a sense of whether these measures we have put in place are working or not. Okay. So mass testing has never really been a strategy that we should adhere to. Number two is also the whole issue of commodities. These commodities are not easy to come by. The testing commodities are not easy to come by. So what we have must be used to really adhere to the strategy that we have that responds to the measures that we have put in place in this outbreak. So for me, mass testing is not a strategy at all.
So as we wind up on this, Professor, we are seeing the mortality rate also increasing with the same number of infections also increasing. What are we likely to see in the coming months going forward? What are your projections showing? Is this likely to remain on a steady rise or will it go down at some point?
Trevor, if fatigue remains and is not addressed, if laxity remains and is not addressed, if denial remains and is not addressed, if utter refusal to adhere to these measures are not addressed, then for sure the spike will continue. We shall not be able to heal the vulnerable and the mortality will continue. And the individuals or the people in the front line, the healthcare workers, are likely to suffer more. Because what we also know now is that there's been a change in the way COVID is presenting. So there are individuals who have COVID who are presenting to hospitals with other symptoms at all, and we only get to know when they are actually tested. So if things continue as they are, then we are heading in the wrong direction. So, my position is that when we recommended the lifting of the restrictions, it was clear that each sector had developed guidelines, from aviation industry to hotel industry, to schools, to universities, to matatu industry, transport industry. All these sectors have guidelines. And what we are saying, revisit these guidelines very, very clearly with all these issues that we have discussed here and ensure that it is communicated. I am not a believer of enforcement. I am a believer of communicating directly to the people themselves, and also communicating in a persuasive manner to ensure that people understand that they are not doing this for anybody else, but they are doing this for themselves and those they love. Okay. So I think all the sectors need to revisit this clearly to address fatigue, to address laxity, to address anti-refusal, and to address denial.
Okay. Dr. Mwachonda, finally from you, I know you speak on behalf of the doctors and you've mentioned provision of PPEs, compensation, training. What are some of the quick wins that you'd like to see as soon as tomorrow so that everything is straightened out for the frontline healthcare workers?
Trevor, the first thing to say about healthcare workers is this. Healthcare workers should be treated with the dignity that it deserves, and the basic things. Professor here is one of those who are affected by what is happening at the University of Nairobi, where the allowances up to 50% of the salaries have been withdrawn. So such things should come to an end. Pay salaries on time, ensure that healthcare workers are promoted. And one thing that needs to be done is also reintroduction of that COVID-19 emergency allowance for all healthcare workers, because that was a motivation. But after 3 months of it being paid, it was withdrawn. So equally, that plus the frustration on provision of PPEs and the other things that I said earlier, all these are the things that need to be done to ensure that the health workforce is motivated to continue in the war against COVID-19.
All right. Thank you so much for making time for us this evening, Professor Mwachonda, Professor in the Department of Medical Microbiology at the University of Nairobi, and Dr. Mwachonda Chibanzi, Secretary General, KMPDU. Before we wind up, let me see if I can sneak in some of your comments real quick. Kipleting Manuela says government should manage well those patients with pre-existing conditions as they are more vulnerable to the virus. And then we see here Grace Story Teach saying the government is saying they should reinforce the restrictions if citizen continues behaving normally. What about politicians? They should lead by example. And then we see also here Dennis Angote says we should all lead by example and do the right thing. Lucas Uko, what about those living in single rooms? What do they do? And of course the engineer Lazaro here says what happened to the much awaited vaccine in Europe? That is something that is still work in progress. Engineer Mohammed Tache Dida says lockdown was only meant to give the government a breathing space to contain the pandemic as it rolls out better COVID-19 measures. The focus should be on educating, engaging and empowering people to live under the new normal. Resorting again to a lockdown will be irrational. All right? That's where we leave it for now. My name is Trevor Ombija. Always a pleasure having you with us on the Monday Report. This is where your voice comes first. Let's do this again next week, and happy Mashujaa Day. It's the eve of a celebration, right? Bye for now.